Hi. Nobody wants to talk about this, but if you're on a GLP-1 program and ignoring your gut, it will get your attention on its own. I'm Dr. Certified Family Medicine, Obesity Medicine Physician, and founder of Summit Metabolic Health. This is Commandment 9. Guard your bowels. Not glamorous, but in 20 years of clinical practice, GI issues are the number one reason patients reduce their dose prematurely or quit entirely. So we're covering it, clinically, practically. GLP-1 receptors are present throughout your entire GI tract. When you activate them with medications, three things happen. Gastric emptying slows, intestinal motility decreases, and as food moves slowly through your colon, more water gets absorbed from the stools, making it harder and more difficult to pass. Layer that on top that you're eating less food overall, which means less bulk moving through the system. And if you're not drinking enough water, which most people aren't, you're now creating the perfect environment for constipation. This is not a side effect that means something has gone wrong. It's predictable physiologic consequence of how the medication works. Predictable means preventable. I've had patients go to the ER with severe constipation on GLP-1 therapy. Abdominal pain, distension, unable to have a bowel movement for 5, 6, 7 days. Every single one of those cases was preventable. Everyone came down to the same three things. Not enough water, not enough fiber, not enough movement. And we're not going to let that happen to you. So let's talk about the 4 pillars of how to prevent this. These are non-negotiable. Pillar 1, hydration. Minimum 80 to 100 ounces of water daily. This is Commandment 2 we applied specifically to gut health. Water keeps stool soft. Dehydration is the fastest path to constipation on GLP-1 therapy. If you're not hitting your water target, nothing else matters. Pillar 2, fiber. Target 25 to 35 grams of fiber a day. Vegetables, legumes, chia seeds, psyllium husk. Fiber adds bulk, draws the water into the colon, feeds the gut microbiome. If you're struggling to hit the target through food intake alone, psyllium husk mixed with water once a day is the simplest, cheapest way of preventing this. Start with 5 grams, work your way up. Don't jump out at 25 grams. Pillar 3, movement. 20 to 30 minutes of walking daily stimulates bowel motility. The gut responds to physical movement. Patients who walk consistently have significantly fewer constipation issues on GLP-1 therapy than patients who are sedentary. This also accounts for the Commandment 3, resistance training, but even walking counts here. And Pillar 4, magnesium glycinate, 200 to 400 milligrams at bedtime. Magnesium glycinate is gentler than magnesium citrate, less likely to cause cramping, highly effective to maintain regularity, also supports sleep and insulin sensitivity. So it's doing 3 jobs at once. Ask me or your provider before starting any supplements. This is the one I recommend almost universally on all my GLP-1 therapies. When to work. Most GI symptoms on GLP-1 are grade 1, present but not limiting your daily life. Manageable, but and we have protocols for this. But contact your provider if you haven't had a bowel movement more than 4 days despite this protocol. If you're having severe abdominal pain, especially radiating to your back. If you're vomiting, unable to keep liquids down for more than 24 hours, or you see blood in your bowels. These are symptoms that need immediate clinical evaluation. Do not wait. The other side of this, diarrhea. Quick note, because some patients experience the opposite, loose stools or diarrhea, particularly in the first 2 to 4 weeks. This is usually transient. The gut is adjusting to the medication. Reduce fat intake, typically avoiding artificial sweeteners, staying hydrated. Give it 2 weeks before concluding it's a persistent problem. If diarrhea is severe or persistent beyond 4 weeks, contact your provider. Dose adjustment may be appropriate. All right, Commandment 9. This was a quick one. Guard your bowels, hydrate, add fibers, move your body, add magnesium. This is not complicated, but requires consistency and requires starting the protocol before you have the problem, not afterwards. I'm Dr. Paul Miranda. This is Summit Metabolic Health. Subscribe for the full 10 Commandments series. Every video gives you clinical context of the programs that you actually need to work. I'll see you on the next one.